It was one of the most controversial announcements from the government this week when a plan was unveiled for children to start returning to schools from the beginning of June.
However, as with a lot of the information we have been given, many of the finer details on how pupils and staff would be protected were a little vague.
Well, in just a moment, we'll be talking to primary school teacher Lizzie Egan-Walsh and our psychologist Emma Kenny. But first, we're joined by Kevin Courtney from the General Secretary of the National Education Union, who's made the headlines today after telling teachers not to engage with planning a June 1st return, but to wait for further union advice. Good morning and thank you for joining us today. So this advice that they would be waiting for, what would that advice be?
Well, we've asked the government to engage with us. None of the unions knew that the Prime Minister was going to say 3-year groups starting back on Sunday. None of us knew that he would then add nursery schools into it when there was a paper on Monday. We've been asking for evidence of a number of things that would inform planning. We've been asking for evidence about how much the virus transmits between children, how much it transmits from children to adults, which adults might therefore be vulnerable. You know, what happens if a child is living with a vulnerable grandparent? Should they be in school or not? I'm afraid that so far the government's guidance doesn't touch on any of those matters. There is no reference in the government guidance to transmission between children, no reference to vulnerable adults. We think we need much more scientific evidence before we can sensibly and safely plan for a return to schools.
So there are a lot of parents now, obviously listened to that advice, which years were going to go back, and the date, the fact that it was going to be June the 1st, and thinking about, all right, well, are we going to do it? A little bit worried about it. So what are you saying now on behalf of your union? Are you saying, don't even worry about it, parents, because we're not going anyway?
Well, I mean, I think it's important to say that even the government doesn't say it's June the 1st. June the 1st is a target date for them if the rest of the science is in the right place, they say. But we're not clear what they mean by that. We're not sure what test they're applying to this matter. But we do think there are lots of things that haven't been sorted through. So, for example, if you're in an infant school, so not a JMI, not a junior mixed and infant, but just the infant part of the school, then you have only nursery, reception, year 1 and year 2, and 3 of those year groups are supposed to come back. And then you're supposed to split the kids from 30 into 2 groups of 15. There just aren't enough rooms in the school. So there is huge amounts of detail that the government has not helped with yet. We want to engage with government. We want to engage on whether it's safe to go back or not, because they haven't given us any public science on these matters. And we keep hearing experts in virology telling us that children do transmit it. And then we hear, I mean, we think these are small numbers of cases, but there are 100 children in hospital in New York City with this new Kawasaki syndrome, which people think is linked to COVID-19. Now, if that's the case, then we will need to be more careful about social distancing between children. I mean, it depends how much virus is circulating in our society, obviously, when we open the schools, how much of a worry these are. But we're not clear from the government how much virus they will allow to have.
So if we get to the point where the government, in one of the briefings that we watch each afternoon, say, right, OK, well, we're beginning to meet the criteria for that opening on June the 1st. I've got to ask you again, if the government decide the criteria have been met and you haven't been given any clearer information, will you say to your members, don't go back?
If we're not convinced that it's safe, then we'll say to members, we're not convinced that it's safe. And if we say that, then there are provisions that people can use. People cannot be compelled to work in unsafe environments. We don't want to be in that position. We want to work with the government on when it would be safe and how you could then safely open schools. But we're not there yet. And if we think it's going to be unsafe, I mean, we really aren't just thinking about our members in this. Our members are teachers, teaching assistants, and their first concern is the safety of the children
If we look at other countries and how they're dealing with it and how they're keeping their teaching staff safe, countries such as China and Lebanon are reportedly spraying children down with disinfectant before they enter. I mean, these are incredible, shocking scenes, actually, to watch as a parent. I couldn't think of anything worse. We did put this to Matt Hancock yesterday, who said that this wouldn't happen here.
You've actually got it here.
Well, let's just take a look at what he said. At that age, can they socially distance? Will they be kept safe? Is Chester going to have to go to school in a mask? Is his teacher going to have to wear a mask? Is he going to have to be spray disinfected as he's walking through the door? We're all sort of filling in the blanks a little bit.
Yeah, look, firstly, he's not going to be having to be sprayed with disinfectant. I did see that from one proposal from a union. That is absolutely not going to happen.
So he says that's absolutely not going to happen. You've said before that this is a possibility.
Well, we think that there's something like that. It's not that we should look at. I mean, the fact that China, South Korea are doing that sort of thing and do have the death rate much lower than ours means there may be something to look at in there.
You can't imagine, sorry to interrupt, you can't imagine that in this country we would spray children like that with absolutely no idea of the health consequences down the line. I mean, this is like, it's like the old days of DDT. No clue of what's going to happen to their health in the future.
No, absolutely. We wouldn't support that. But the government says, in the guidance that they have brought out, it says that in schools you have to remove soft furnishings, you have to remove soft toys, you have to remove toys that you can't clean easily, and that's because of the risk of virus being on those things. So you could imagine children, as they come in, washing their hands, and then you could imagine possibly disinfecting their belongings, the bag they've brought with them, not spraying them like in those shots, but you could imagine disinfecting their belongings. We'd like the scientists to tell us what sort of contribution that would make to keeping us all safe.
Which makes sense. Thank you, Kevin.
Thank
you very much indeed. Let's go now to Lizzie. Lizzie's a head teacher at Lyndhurst Primary School in Oldham. And hi, lovely to talk to you.
Morning, Lizzie.
Lizzie, so you heard there what Kevin was talking about, and how the Joint General Secretary actually feels of the union. So if the government were to say, OK, we could be all go for June the 1st with some sections, some small classes, taking the kids back to school, what do you say as a head teacher?
I think that we have to remember that schools are already open to children, to a certain number of children, and our staff are already in the situation of working on rotas and putting as much safety precautions into practice as they can. We need to remember that what the government has produced is guidance and advice. It's what they would like us to do. I think as a school, we need to look at it individually. We need to work with the unions. I'm part of the Multi-Academy Trust. My school is part of the Multi-Academy Trust. We're really lucky to be part of that trust because they're working with us to support whether we can admit more children into school. And I think that's the key, whether we can do it or we can't. We're not prepared to admit more children into the school if it isn't safe to do so. We are looking at risk assessments. We are looking at planning. We're working with staff and families and children, the local authority, the DfE, the unions and our trust. And we will do what we can do that's right for our individual circumstances.
Practically, how easy is it going to be to keep reception kids socially distanced? Because even if you have desks that are separate, that are 2 metres apart, so you can have that in place, what about at playtime or break time, or even when a kid just walks into the class or drops a pencil on the floor? It's going to be quite difficult to control that age of child.
Yeah, it is going to be difficult, Holly. It's going to be impossible. Children of that age cannot socially distance. It isn't practicable. They're not going to understand why. If they come into school, they can't sit near their friend. They can't sit with their friend at lunchtime. They can't play with their friends. There's going to be the complications of cleaning everything. What's safe to touch? If a child falls and hurts himself, does a member of staff comfort them? Or do they stand away and say, I'm sorry, I can't help you today because I've got to socially distance? So there's lots of things to consider. And if once we've considered all those factors and it isn't practical to bring those children back into school, then we don't do it. We have to look at what is right in our setting, in our circumstances, for our families, our children and our staff, and we need to make choices based on those. We're working on what is impossible and what is possible. And I can't say at this point whether we will be open at the beginning of June or not for extra children to come in. We're already open for certain children and will continue to be so for those children. Whether that will extend, it's still in the planning stage, and I can't confirm or say we will or won't be.
Do you think it was an overly quick announcement?
Yes. Yes, definitely. I think that it's come out very, very quickly, whilst consultations with the unions were still going ahead, and perhaps, you know, I'm sure the government think that they have done this with the right intentions in mind, but the practical elements have not been designed by people who work in schools. They've been designed by people who write policy.
All right, thank you very much for joining us this morning. We're going to speak to Emma Kenny now. Emma, nice to see you. So obviously, you know, parents are feeling anxious about their children returning to school, but children themselves are feeling anxious about returning to school. How do you explain to a child if they are worried about going back?
I think there'll be two distinct levels here. So one level will be children who desperately want to go back to school. So there are lots of children who can't wait, even though they know they're not going to be able to apply those social distancing rules. I think I completely agree with that. Kids are kids. When it comes down to your anxious child, I think you've got some clear messaging. So first of all, children have a temperament. So you might have a child with a more sensitive temperament, but also they live a great deal of what they're experiencing around them. So if you feel hyper anxious, be aware that that's probably translated a little bit to your child. So make sure that you take some time to communicate the fact that, you know, you won't let them go back to school unless it's safe. You are going to follow the guidelines and the advice that you're being given, that teachers are experts and they're going to be looking after and protecting them. Children get a huge amount of reassurance from their school environment. So for some children, that's the major stability that they have in their experience. So school doesn't just symbolise a place of safety, it's a place of sanctuary for children. So I do think that it's also important that there are children who are very anxious that they're not going back to school. So if your child does want to go to school and you're not feeling it, you have to have conversations with them about being open about their feelings. With little children, I'd use things like worry jars. I'd literally start using them right now because you're going to be competing with this in the very near future. I'd sit down with them at night. I'd ask them to think about a few worries that they have, pop them in a jar. Every single morning, get up, talk about the ones that they feel have resolved and the ones that they haven't, continue to put back in and relocate that again. The most important thing that you've got to remember now is we do have to get back to normal at some point. So even if you're not crossing this bridge by June, you are crossing this bridge by potentially September. So you need to start having those discussions. And most importantly, I do feel a level of empathy for the government, even though I obviously have more empathy for teachers. The problem we've got is part of this is Mother Nature. So I think we have to also have really, really honest conversations with children about the fact that bugs and viruses exist. What we don't want to do is create a whole generation of children with high anxiety around health. So I do think that parents need to be having those discussions right now. And I agree with everything that's been said by the union and by the teacher who's a professional and knows that area better than anybody.
Just quickly, should you feel bad? We've been told by the government there'll be no fines if you don't send your children back. But should you feel guilty as a parent if you find out that the school is open and your child could be going back, but you don't want to send them?
Oh, no, absolutely not, Phil. You know how it is on This Morning. We're going to be pragmatic and honest. The government aren't going to fine parents because they know that parents have a right to that autonomy. And also, my own kids, they really want to go back and see their friends. They really want to. But if they feel that they're going to have to socially distance, they've already said that they'd vote with their feet and they wouldn't want to go back. And I would absolutely second that. But at the same point, I would never, ever do down a parent who is desperate to get their child back into school. It has to be a call for the parents and the child. And obviously for the health officials that are advising us.
All right, thank you. Thank you all for joining us this morning.